Hi, I'm Professor Matthew Peters, Head of Respiratory Medicine at Concord Hospital. General practitioners are the foundation of asthma care in Australia, and while asthma care and clinical outcomes have definitely improved, a University of Sydney survey of symptoms we conducted has shown that we can still do better with our asthma patients. A significant percentage needed hospital care for acute attacks, and a disturbingly high proportion of that group were only using reliever medications, usually Ventolin. Now, you know as well as I do that's not satisfactory and not best practice care. There are, however, lots of reasons why patients don't use their preventers or inhaled steroids. You may well have prescribed a preventer and you think you've explained it to them, but patients can leave the surgery not understanding what preventers do and what their benefits are. Patients often want a quick fix and feel that the blue puffer gives them that, and wrongly believe blue puffers prevent attacks. The thing is that many people, perhaps doctors and patients, believe we've got asthma sorted when we don't. And the answer is simply better attention to detail. Get it right though, and the rewards for doctors and for patients are huge. Here's what could make an enormous difference in a standard GP consultation. If a patient has asthma requiring acute medical care or treatment with oral steroids, this is a big issue. They must be prescribed a preventer, and we have to help patients understand what a preventer does. We have to talk a common language. We have an obligation to check that adherence to treatment is good and that inhaler technique is correct. You can verify that asthma symptoms are controlled by asking about selected important symptoms, such as night or morning wheeze and breathlessness, or even better by using some simple, quick questionnaires such as the asthma control test. Patients can actually complete these in a waiting room before you see them. If this can be matched with a test of lung function, then all the better for your clinical assessment. In the air supply study of over 2,500 Australians with asthma, 45% had poor asthma control. Those only using a reliever or a blue puffer deserve special attention, and perhaps sometimes more than we give them. From that same study, 10% of this group actually needed acute medical care in the previous year and had used no preventer. 2 out of 3 of those had actually been to a GP separately. I think you'd agree this is less than the standard of excellence we aspire to, and yet simple interventions can achieve benefits within weeks. Remember the Mars bar jingle. A Mars a day helps you work, rest and play. Good care of asthma should see no exacerbations leading to loss of work or education. It should minimise sleep disruption and make sure that exercise tolerance meets patients' hopes and reasonable expectations. Help to make the highest standard of asthma care available to all your patients. The results will speak for themselves and the benefits will be seen very quickly.